The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors, those interested in learning more about TMD. I am Tony Urbanek, and we are gathered for the next episode of TMD Demystified. Today, we're going to talk about burning mouth and tongue and TMD, TMJ. There is a relationship between these two problems. Now, if you are a general dentist or a dental specialist, you have probably run into more than one patient who comes in and complains at one time or another, if you've been in practice for very long, of burning sensations of the mouth and oral cavity, or just nondescript sensations. You say, well, it feels like, there's something wrong inside my mouth. Errant sensations inside the oral cavity. And up until now, there has not been any reasonable explanation for this problem. I'd like to read just a paragraph that I prepared for the blog on this same topic, just to get us started, to tell you what the AMA Journal of American Medical Association, has to say about burning tongue and burning mouth. Burning tongue and other less than comfortable sensations of the tongue is a relatively rare phenomenon. According to the Journal of the American Medical Association section on otolaryngology, burning mouth syndrome occurs in about 90 to 120 people of 1,000 individuals. 90 to 100 out of 100,000. 90 to 100 out of 100,000 people complain of burning sensations in their mouth, although some studies report a frequency as high as 18% of the population. Women are 7 times more likely to have burning mouth syndrome. Age is a known risk factor, with the average age at diagnosis of 59 years. According to the AMA Journal, there is no known cause for burning mouth tongue syndrome and no known effective treatment. Some benefits concerning quality of life have been shown by using cognitive behavioral therapy, talk therapy. Very nondescript, generalized comments, and I have kind of more to say about that. Cognitive therapy, kind of talking someone out of their problem. I'm not even sure what that means. But I can tell you from my own personal experience, anecdotal, but also some very specific anecdotal experiences I've had, actually many of them. First of all, let's address the cognitive therapy. Most of the people that I have experienced with burning tongue, burning mouth sensation have been highly anxious. Let's just say, to put it nicely, highly anxious people. And that goes back 50 years, way back to my first area of training and my first years in surgery of the oral and maxillofacial regions as an oral and maxillofacial surgeon. It was obvious to me that patients who experienced burning tongue also had the kind of personality. They were high-strung, anxious. A lot of them were on psychiatric drugs, problems in life, et cetera, et cetera. I didn't make much of it at that point in time. I didn't try to do any studies or other than the reflection that I just mentioned. Now, go ahead, go forward 45 years in my experience with TMD. What I began to see was that there was some kind of relationship between patients who complained of burning tongue and burning lips and burning mucosa inside their mouth and TMD. I'm not going to quote statistics because I didn't run a study, but I realized that there was some relationship there. And after the last 12 years of treating non-surgically TMD patients and doing a very specific study on TMD itself and TMD relationship with the symptoms that are associated with TMD, I began to see quite clearly that there was some kind of relationship, and I tried to describe it or study it to the point of trying to explain how in the heck can you get burning tongue when the cause of TMD is inflammation of the temporomandibular joint. Now, let me repeat that because I'm not sure how long or short this presentation is going to be, but the whole presentation is going to be associated with what I have to say next. We know now that TMD is nothing more than chronic inflammation of the temporomandibular joint, which creates all of the disparate symptoms, headache, earache, jaw pain, neck pain, tinnitus, which is ringing in the ears, subjective hearing loss, which is that feeling of fullness in your ears, where the audiologists and the ENT surgeons can't find anything wrong with your hearing mechanism, but you constantly say, I'm telling you, my ear, I can't hear as well, it's full of water. Dizziness and vertigo, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking. Those are the accepted, well-experienced symptoms of TMD, TMJ. And I've talked on multiple episodes of how that comes to play and how that is generated by chronic inflammation within the temporomandibular joint. But today we're talking about the symptom of burning tongue and what that has to do with TMD. So it didn't take long when I actually began to investigate the disparate symptoms of TMD to determine what the relationship is. So I'm going to try to share my screen here with you and show you something that I think is very significant. This is a diagram directly out of Gray's Anatomy. Actually 1953 edition of Gray's Anatomy of the lateral temporal bone, temporal and the glenoid fossa, to get you oriented if you can't see it already. Styloid process, external auditory canal, glenoid fossa. And I want to point out a anatomical structure that I've spoken on before, which is the petrotympanic fissure. Now, the petrotympanic fissure is a fissure that goes through the temporal bone, a fissure that's about 2 millimeters long. It is a potential opening because it is a fissure. It can be closed, it can be open, but a fissure is a potential opening between two structures. This fissure, called the petrotympanic fissure, is also known as the Glaserian fissure because it was described and written upon and put in the literature by Dr. Glasser in 1680, who is a Swiss anatomist. So it is known as both the petrotympanic fissure and the Glaserian fissure, and the location or entrance to the fissure is located at the posterior portion of the glenoid fossa, basically directly between the bones of the external auditory canal and the temporal bone, which houses the glenoid fossa. Now, let's see if I can bring up. Yep. Now this is the same edition of Gray's Anatomy, and now you're looking actually as you are seated inside the middle ear, looking at looking at the middle ear structures, and I want to point out that the petrotympanic fissure, which now enters the area from the glenoid fossa, comes into the middle ear. This is the Glaserian fissure right here. And the Glaserian fissure allows, among other things, chronic inflammatory exudates. I doubt cells themselves, but possible, but certainly the chronic inflammation exudates to travel from the glenoid fossa of the temporomandibular joint into the middle ear, which creates your tinnitus, subjective hearing loss, and vertigo. But also, we have a nerve called the Chorda Tympani nerve. Well, as you may recall from your anatomy, because it was stressed significantly in my anatomy courses in dental school, and also masters in anatomy physiology that I have, the chorda tympani goes through the Glaserian fissure, petrotympanic fissure, and travels down to the anterior 2/3 of the tongue and provides taste sensation to the anterior 2/3 of the tongue. So it's my point being that the exudates of chronic inflammation that travels through this fissure into the middle ear and creates tinnitus, subjective hearing loss, and vertigo can also damage this nerve, chorda tympani, as it travels down through the Glaserian petrotympanic fissure and can create burning of the tongue. So patients who experience symptoms associated with the middle ear, or even if they don't have symptoms of the middle ear, they have symptoms of TMD, headache, earache, jaw pain, neck pain, which is nothing more than chronic inflammation within the temporomandibular joint, because now we know that chronic inflammation creates all the symptoms. So chronic inflammation can damage if it surrounds a nerve, and if it stimulates that nerve, patients can complain of a burning sensation of the anterior 2/3 of the tongue. Now, I want to make a point in my experience, that some patients find it difficult to describe where the pain in their mouth is coming from. I think if you've been a dentist very long and you ask patients about their toothaches or their periodontal pain or whatever pain they're having, they have some difficulty in describing the location of that. That is actually borne out in the fact that many patients complain that they have dental pain associated with chronic inflammation of the temporomandibular joint. And that is a fact. It is shown very well because there are many patients who will talk a dentist and taken out teeth because they claim their pain is coming from a tooth, when actually the pain is generated by chronic inflammation within the temporomandibular joint. And we see this not infrequently with patients who come to see us. They have multiple missing posterior teeth. And I say, what happened to this first and second molar here? And the answer is, well, Dr. So-and-so took it out because I told him that the teeth hurt. And I said, no, it's actually pain generated by chronic inflammation within the temporomandibular joint. So my point is the patients do have a difficult time sometimes describing their sensations of pain and discomfort in terms that are, number one, realistic, and number two, that the doctor can figure out. In this case, I think that discomfort of one kind or another, burning sensations, or erratic sensations of the tongue is often confused with other complaints of burning lip or burning mucosa inside the mouth. And my recommendation, because I have done it, is to carefully question and examine the patient to elicit whether or not it is the lip itself that has a burning sensation, or whether it's the anterior 2/3 of the tongue, which is the innervation of the chorda tympani. So it's pretty amazing how pathology within the temporomandibular joint can create all these disparate symptoms. Can a study be done on this? Yes. Should a study be done on this? Yes. Has a study been done on this? No. I think the study to actually determine the relationship, what percentage of patients with TMD also complain of burning sensations within the oral cavity, especially the tongue. I think it can be done if the statistics that are quoted by the Journal of the AMA, American Medical Association, section of otolaryngology, is that up to 18% of the population complain of errant burning sensations of the tongue and other structures within the oral cavity. If that is true, this certainly needs more attention. And if my description of the relationship of chronic inflammation and inflammatory exudates stimulating the chorda tympani easily explains why temporomandibular joint disease it also is associated with and can cause burning tongue and oral cavity. So think about that. If you'd like to question me about this, I'm available at tony@tmjservices.net. Our website, www.urbanektmj.com, will give you a plethora of information about the disease and the discovery that I've just went through very briefly, that chronic inflammation within the temporomandibular joint creates all the disparate symptoms, and that the solution actually is a very easy solution, which is nothing more than a protocol using a very carefully constructed oral device that unloads the temporomandibular joint by disoccluding the posterior teeth with a device that the patient can wear appropriately long enough, according to a protocol, 24/7 for 2 months, nighttime only, the rest of their life, which will predictably make the symptoms of chronic inflammation decrease. Because if you unload a joint long enough, like a set of crutches unloads a bad knee, then the inflammation will die down and the symptoms will diminish. It's that simple. If anyone would like to criticize me, you're also welcome to contact me at tony@tmjservices.net. I hope this is helpful to you in your treatment of patients. That's the reason I do these episodes. I definitely would like to hear comments or your experience with these same kinds of symptoms for your patients. But until the next time, which will be on next Tuesday, we'll pick another topic that will explain more parts and things having to do with TMD Demystified. I am Tony Urbanek.